Welcome to the Patient Advocacy Show. I'm Dr. Michael Warner, along with our Patient Advocacy Club members and research team at Touro University California. Disclosure, the views in this presentation may not necessarily represent the views of Touro University. In this episode, we will address TUC Documentation Guideline number 6. Patients should routinely read their entire health record note, which includes the history, examination, and medical decision-making after every medical encounter. Health record documentation rules are about to experience a major overhaul starting January 1st, 2021, and we've been preparing for these changes and have considered intended and unintended consequences. Based on our research work we've been doing for over a year, we assembled a list of guidelines to help everyone accommodate new rule changes. We formulated Touro University California documentation guidelines and published an executive report in the September 2020 issue of AAPC's Healthcare Business Monthly magazine. In the comment section below, we will share with you our full 37-page report. To discuss our TUC Documentation Guideline 6, let me introduce you to some of our team members. Our team is composed of Touro University California osteopathic medical students and postgraduate students in Touro's Master of Science in Medical Health Science program. Tonight, we also have two special guests. Whitney Simmons, RN, soon to be awarded her nurse practitioner degree, is the Community Outreach Coordinator for the IgA Nephropathy Foundation of America. Welcome, Whitney. And we also have Touro Administrative Coordinator and Project WARM Coordinator, Yvette Elizabeth Carrillo. Welcome. So our guideline statement number 6 is patients should routinely read their entire health record note, which includes the history, examination, and medical decision-making after every medical encounter. Why is this guideline important?
As individuals, we need to be aware of how our medical story is represented in our health record. The best way to be sure is to read your health record after every medical encounter.
I can add to that a little bit from my experience as a hospitalist scribe. When admitting patients into a hospital, physicians often refer to the patient's past medical history by accessing their health records of previous medical visits. A physician uses this information along with their current review of the patient's condition to make judgment about their health and treatment. Research shows that there is significant discordance between a patient's medical documentation as provided by their physician compared to what patients actually report. One study found that almost 1/3 of the symptoms that were reported by patients were not documented in the health record. Misinformation or lack of information in medical records can cause errors in formulating an accurate diagnosis and effective treatment plan. This is why it's critical for patients to have access to their medical records and read them in order to report any errors or discrepancies.
Are inaccurate health records a consequence of medical providers not doing their job?
This with CMS's Patients Over Paperwork initiative, which started in 2017 in response to an executive order to remove unnecessary regulatory burden. Adopting computers with electronic health records was supposed to make documentation easier for doctors, but too many tasks were assigned. As a result, providers struggled to keep up with all of the typing and clicking on a keyboard during a medical visit. Even with a medical scribe, all of these duties created too much paperwork. The emerging rules call for doctors to spend more time focused on the patient rather than a keyboard. For patients, it's all about empowerment. New government rules starting January 1st, 2021 are shifting the gathering of information from being a doctor job to patient empowerment, where patients are empowered to write their own story, their own narrative, in their own words, and have it documented in the health record. To make sure this is effectively done, patients should read their health record after every medical encounter.
So new policies are designed to make it better for patients and medical providers. In reading your health records, what is written about you and what is written about what you said seems so basic. Why don't people routinely read their health records?
Of two main reasons, awareness and ease. Most people are not aware that they have the federal right to access or read their health records. I'm not talking about the discharge papers you're given after a medical encounter. I'm referring to the actual records, which include your history, examination, and medical decision-making. The second issue is ease. The Standards for Privacy of Individuality Identifiable Health Information of 2001, also known as the HIPAA Privacy Rule, has specific parameters for individuals to access their health records. It should be as easy as completing a request form, but in reality, it is often very difficult for people to access their health records. I also want to clarify, reading your health record is more than reading a discharge instruction. It includes your history, which is the medical interview. It's your story. It also includes the examination, which is any physical examination that may have been performed during your visit. And lastly, medical decision-making, which includes the assessment, establishing a diagnosis or diagnoses, and the treatment plan.
All right. How are emerging policies a potential remedy?
New government policies for health record documentation redefine the roles of patients, as well as medical providers such as doctors and also medical staff members. What these new roles do is that they ask patients to be active participants in the delivery of their health care. Rather than be passive and only answer questions when called upon by the doctor, new roles encourage the patient to co-author what is written about them in their health record, to help tell their personal story. I see these new policies as a remedy because it will encourage patients, providers, and medical staff members to work together as a team. Much of this is dependent upon patients reading their own health records to make sure the information is accurate and that their story is properly documented.
All right. So when has there been a similar problem accessing records of any kind in our society, and what did we do about it?
In the past, consumers had trouble obtaining receipts of purchase, viewing their credit score, and disputing errors. In 1970, the Fair Credit Reporting Act, Fcra, was enacted as U.S. federal government legislation to promote the accuracy, fairness, and privacy of consumer information contained in the files of consumer reporting agencies. This act led to widespread consumer knowledge of checking your credit report, collecting receipts after transactions, and having the ability to dispute inaccuracies. In the same way we check cash register receipts, bill statements, and our credit reports, we should check our health records. Despite becoming law in 1970, it took years before everyone became aware that they could view their credit report and have easy means to do so. The Health Insurance Portability and Accountability Act, also known as HIPAA, became law in 1996 to protect patient health information. In 2001, additional rules were added to HIPAA, such as the Privacy Rule, which is very specific for an individual's right to access and amend health records. I think we are finally catching up to patients taking an active role in their healthcare delivery by reading their health records for accuracy.
All right, so new health record documentation policy changes create a mindset encouraging patients, which can be any of us, to read our health records and also co-author what is written about us in our health records. I mean, we've all experienced filling out forms in a doctor's waiting room, but new rules have become more explicit, encouraging patients to author the history in preparation for a medical visit and for the patient's story to be captured in the health record. What are some of the challenges to accommodating these new rules?
Although new rules value patient participation in information gathering and management, it will take time for our culture to accommodate. From the individual perspective, people need to gain awareness of their rights and responsibilities. If we don't engage, we will fail to assure accuracy in our health records. Our work, which offers free online prehistory forms both in paper and in digital formats, are available for free and for public use. As awareness grows, particularly among all individuals, that government rules are encouraging people to co-author and read their health records, we will overcome these challenges.
In addition, providers and health systems need to make the process easy. Currently, it is difficult for most people to access or read their medical records. Sure, through a patient portal, you can read your medication list and lab results, but we're talking about the entire history, examination, and medical decision-making. For the individual, rules require a patient to complete a protected health information release form. All medical settings are required by law to have this form available to you. You will need to identify who you are, what parts of your record you want to see, and the reason for obtaining those records. Your reason may be that you plan to see a specialist and would like to bring a copy of records with you, or you may want to read them for your own personal knowledge. You may need to be specific with the dates of your requested medical records, such as requesting records from January 2020 through April 2020. A fee which varies by state may be required, but these charges are usually meant to be fair and reasonable in cost.
We mentioned in our TUC documentation guideline that even Vice President Joe Biden had great difficulty obtaining health records for his son Beau while he was Vice President of the United States. However, as Vice President, he was finally able to access those health records, which were delivered from one institution to another. He commented publicly that the process is way too difficult. Unfortunately, his son Beau did pass away 5 years ago, but it does not seem any easier for someone to access their health records now. It should be as simple as completing a form and picking up some papers or receiving a secure email.
Moving to patients co-authoring the health record, let's say the history part, can someone share their experience?
Well, I attended a clinical simulation lab at our campus with my son as the standardized patient. We completed a prehistory while at home in preparation for the visit. And as a parent, I really liked the process. During the visit, I did not need to remember the details or think about how I should present the information. I was able to submit my prehistory as a written request to amend, in this case, my son's health record, in accordance with federal laws. The medical students and then the doctor's roles read the prehistory and understood all of my concerns in one story. Then they asked a few more questions and moved on to conducting the examination. As a mother, I felt heard and understood when representing my son's attempt to seek healthcare services.
Very powerful. Why right now is clinical application of the patient's right to access and/or amend not always achievable?
Clinical application being not achievable may be viewed by the patient's willingness to participate and the provider's willingness to accommodate. I believe that once awareness grows of patients being their own advocate, then health record information will be better shared in accordance with HIPAA privacy rule. When patients request to access their health record, it will be a routine expectation to better understand what is documented and assure accuracy. Within that framework, providers should become more comfortable granting patients access to their health records, particularly when patients request to read them.
So can you think of an example when a medical provider should deny access to a person who requests to read their health record?
A patient who is receiving medical care for the onset of new headaches, which are very severe. Perhaps a CT scan was ordered and it shows an area suspicious for a tumor. The radiologist recommends an MRI with gadolinium to better identify the mass. In this case, the CT report is in the health record and the provider may have added a note reflecting a phone call discussion with the radiologist. The health record may entertain a differential diagnosis of tumors such as an astrocytoma or a glioblastoma. Now may not be the best time for the patient to read this. The provider may want to see the patient face-to-face, especially if the MRI can be obtained quickly. This is an example where full access may not be good because the information could harm the patient, in this case, causing unnecessary anxiety.
I agree. There will certainly be instances where the provider may need time to figure out what is going on. The HIPAA privacy rule gives the provider 30 days to consider access with an elective 30-day extension. I'm not sure why a provider would need 60 days. For a patient requesting to read their health records or needing it to bring it to a different provider, or let's say they're just moving to a different town or need to see a specialist out of network, or simply just want a second opinion. 60 days is a generous amount of time for the provider, but may create unnecessary anxiety for the patient.
Yeah, for sure. I mean, there may be times when it is reasonable for a patient not to read their health record. Most of the time, however, it should be shared. New rules promote patient authoring of the history part of the health record and counter note, and new rules also give medical providers the choice of conducting their visit based on either a new one-page medical decision-making grid or new total time rules on the date of service. The history, as you remember, is a list of about 30 standardized questions defined by 1995 and 1997 documentation guidelines. Can you envision these new rules working well for patients and medical providers?
I can see it working. Rio spoke to her experience. I like the protocol in the 2017 Prehistory JAOA article, where patients received a printed copy of their entire encounter note, inclusive of history, patients, and medical decision-making at the checkout window after the office visit. This is a best practice.
New 2021 rules in the outpatient office setting should be a great benefit for providers. Currently, pre-2021, providers have been forced to go back to health records and finish documentation after hours, such as at night or on the weekend. If we accept the patient's story in the health record, then the provider is saved an enormous amount of time. Rather than frantically typing during a medical visit or trying to remember what the patient said later that night or over the weekend, providers can spend their time focused on what diseases or conditions might be present, what data is needed, such as more tests, and what risks need to be taken to deliver care. All of this adds up to medical decision making, which is what the new 2021 one-page grid is all about.
I absolutely love this discussion. I'm a registered nurse who's about to earn my degree as a nurse practitioner. I know what it's like to deliver care, particularly in the intensive care unit. I also know what it's like to be a patient. I'm a community outreach coordinator for the IgA Nephropathy Foundation of America. IgA nephropathy is a condition of a protein accumulation in the body that can destroy renal function and require dialysis or kidney transplantation. In addition to seeking new cures, our organization is very passionate about patient advocacy. I support patients taking an active role in their healthcare, which can include accessing and reading your health record. Congratulations, medical students. I absolutely love this type of patient advocacy discussion. I am hopeful for patient care that will continue to improve because of conversations like this.
All right, so here are our take-home messages. After a medical encounter, ask to read your health record by asking for a Protected Health Information or PHI release form. Complete the form and indicate that you want to read your records, let's say from that specific date, for your own knowledge and to assure for accuracy. Once you read your health record, ask yourself whether your story is complete and accurate. We will show you in our next patient advocacy show how to amend and co-author your health record to better tell your story.
Public outreach message. I hope you enjoyed this presentation by the Touro University California Patient Advocacy Club. In the comments section below, please consider clicking on the link and completing an anonymous survey, which will help us as researchers better understand your needs and concerns. In future presentations, we will address other patient advocacy issues and share the survey results.
Thank you, Shalaya. And thank you to our guest, Whitney Simmons. And thank you to our team. And thank to all of you for watching. We'll see you at the next Patient Advocacy Show.